I think emphasis on quality care and the patient-first ethic, which sets Washington Hospital apart from other organizations, mostly because it is ingrained in the entire organization, not in just a few people.
Quality care and the patient-first ethic. That's what I believe in.
Quality care
and the patient-first ethic.
That's what I believe in.
Quality care and the patient-first ethic. That's what I believe in.
It's one of the best hospitals in California and in the United States, and I'm very proud of Washington Hospital.
Quality care and the patient-first ethic.
Quality care and the patient-first ethic.
That's what I believe in.
That's what I believe in.
That is what I believe in.
I have found Washington Hospital to be on the advancing edge of medical care throughout the 50 years that I have been here.
I'm alive today because of the care that I've received at Washington Hospital.
From the moment we first opened our doors, Washington Hospital has been committed to the patient-first ethic by providing the highest quality care. The fact that this commitment has been successfully carried out for more than 50 years is a tribute to the talents and dedication of our physicians, nurses, employees, volunteers, and administrators. At Washington Hospital, quality care drives everything we do here. We take advantage of the latest technologies and employ evidence-based medical practices. We engage the services of the finest physicians, nurses, staff, and volunteers, all of which helps ensure that every one of our patients receives the best health care.
I started my productive career at one of the top medical centers in the world, and then came to Washington Hospital to focus more on patient care. I've been fortunate to work with the hospital administration in developing a neuroscience institute that brings the highest quality care to community setting.
Here at Washington Hospital, we always strive to be the best in everything.
The hospital has mechanisms in place for any employee, caregiver, nurse, or physician to bring attention to quality issues without repercussions.
This means that the process includes working together to assure that care is given in a safe manner and that the highest quality of care is provided.
The quality of care is absolutely excellent. They take a real interest in the patient. I think that that's the primary thing they're concerned about. They make sure that you get the right doctors and the nurses take wonderful care of you and the staff.
Well, I have many patients who've received care at more than one institution in their lives. In fact, I have patients that back when I used to split my practice between two different facilities, patients who would sit next to each other in my waiting room, one having been operated on at Washington Hospital and another having been operated at another institution. And the patients that I operated on at Washington Hospital were uniformly happier, more pleased with the quality of their care. They would comment on the cleanliness of the care unit, and it really became an ethical issue to continue operating at the other institution.
The extremely personal care that they give each and every one of us when we come here as a patient or an outpatient. The friendliness, the concern is what really catches my attention.
My sisters sometimes come into the emergency room in critical situations. We've also had sisters who have been here in the hospital for many weeks in critical condition. And in each case, we've experienced the doctors, the nurses, and the staff as respectful, concerned, understanding, dedicated professionals.
I came here 10 years ago mainly because of the quality that this hospital serves. I've been a patient here, my family have been patients, a lot of my friends have been patients.
I don't think it's an exaggeration to say that if it were not for the expertise and diligence of the doctors, nurses, and staff of Washington Hospital, I may not be sitting here talking to you.
Washington Hospital's physicians are caring, dedicated, skillful, and sensitive. I'm proud to be a part of such a distinguished group, working to provide the highest quality of care to patients in our community and from around the world.
The quality of care at Washington Hospital, the attitude of the staff at Washington Hospital are better than the attitudes of the staff at any hospital that I've ever worked at.
The patient-first ethic is Washington Hospital's most important core value. It is our approach to healthcare, and it is our obligation to each patient we serve.
Washington Hospital had the vision to develop a world-class Neurosciences Institute and Gamma Knife Radiosurgery program. I'm delighted to be a part of this program and to participate with administrators and physicians with the highest degree of integrity, all of whom are guided by the patient-first ethic.
Simply put, all decisions at the hospital begin and end with the patient's well-being as the primary concern.
That philosophy has been promoted by the governing board, by the chief executive officers and the administrative staffs, and supported by the medical staff in its entirety.
The staff at Washington Hospital truly embody the patient-first ethic. I see it lived out day in and day out on the joint replacement unit and elsewhere in the hospital. And the patients see it too.
When you go in, you're automatically nervous, and they take that away from you right quick and make you feel like you're at home. And that's what I call tender love and care.
I have firsthand knowledge of over 1,000 hours working in the emergency room, and I see that all the time. And believe me, if there was anywhere that I had to go for either myself or my family members, it would be to Washington Hospital.
It's almost like a family, the way they take care of you, and they just watch out for you.
Patients come first, and what I've seen firsthand is always good quality care and an interest in doing what's best for the patient.
Washington Hospital just has a different feel about it. It definitely feels like it is a community hospital, like it is a family hospital. Since I've been coming here, I know it sounds like a made-up piece, but I have never once run across someone who I didn't feel had my well-being or other patients' well-being ahead of anything else.
One of the many things that impressed me was that my concerns and my comfort were always in the forefront of their actions.
We all want to help each other. We all want to work for the community. We all want to do what's best for the patient.
Because it is the patient is the reason for the organization to begin with.
In 2004, I was asked to become spiritual care coordinator here at the hospital. And I was overjoyed by that opportunity because I know how important patients are to those who work here at Washington.
I've practiced in Fremont for 43 years. I've been on the hospital staff for the entire 43 years. During this time, I've learned that Washington Hospital has always placed the patient first.
We at Washington Hospital believe that patients come first, and that's true in how we credential our physicians and how we review our physicians.
The staff has excellent training and practices the highest level of care. They many times go beyond the call of duty.
One night I was having a lot of problems, emotional problems, and a young nurse came in and sat and just talked to me for 2 or 3 hours to calm me down. And that has always stuck with me because I know that wasn't her job. That's just something that the people in this hospital do. They go beyond what is expected of them.
The reason I like working at Washington Hospital is because every caregiver in this facility is focused on the patient. We are all trying to make sure that every patient is treated with respect, with dignity, as well as we treat each other with respect and dignity.
I've been recruited to go to many different hospitals in the country, but I stay here because this is a quality place, and I believe in what they believe in, which is the patient care ethic, and patients do come first here, and I see that every day.
We are a community hospital. We exist to provide the finest health care possible to the residents of Washington Township Healthcare District and surrounding Bay Area communities. We could not provide this level of care if it were not for the dedication of everyone at Washington Hospital. Those who practice medicine, provide care, volunteer, or support the hospital in so many other ways.
I was a member of the medical staff before the hospital was built. We, as a small group of 8 doctors, assisted in the planning of the hospital from a doctor's standpoint.
The Service League has been in existence for 53 years, even before the hospital. We have a lot of members who have been here for 25 years and more. It's over 1,655,000 hours that we have given to the hospital. And the reason why we're doing that is because we believe in what Washington Hospital stands for.
I've been practicing at Washington Hospital since November 1978, and I'm a past chief of staff. I believe in the hospital so much that my children were born here, my son had his appendectomy here, and I've had surgery here.
I grew up here in Fremont. I went to high school at John F. Kennedy High School in Fremont. When my training was done, I wanted to come back and work in the community that I grew up in.
I used to live here, but now I moved to Stockton, but I still come back here to do my cardiac rehab exercise. I enjoy very much coming back to hospital. It's just like family.
I'm retired and on a fixed income, and I have the ability to move anywhere in the United States and take those same dollars and perhaps get a lot more than I can here in Fremont. But one of the reasons I won't leave Fremont is because of Washington Hospital, what I consider my hospital.
Washington is truly community focused and has concentrated energy on how to be a positive center of health education, of service to the community here in Fremont.
Washington Hospital is uniquely good as a community hospital. It has been far-sighted, it's been very well managed. There are very few hospitals which stand alone as this one does. The benefit of standing alone is that our attention and our profits can all be directed to the benefit of the people in our community.
I have been working in the Fremont community and Washington Hospital healthcare system since 1985. I am very proud to be associated with Washington Hospital healthcare system.
I take great honor in being a part of this place and for all that it stands for, particularly so many opportunities to reach out to the community in so many different ways.
I've worked in hospitals for 30 years. I've been a registered nurse for 25 years. And I've enjoyed being a staff nurse at Washington Hospital for the last 17 years. This is really a great hospital. Those who work here love their jobs, and they're all dedicated professionals. The bottom line is that all patients at Washington Hospital get great care. I know this, and I live by that. I brought my mom and dad from outside the area to come and be treated here, because I wanted them to have the best, and they got the best.
And I would recommend anybody, including any members of my family, to be treated here, because I am Washington Hospital.
I am Washington Hospital.
I am Washington Hospital.
I am Washington Hospital.
We are Washington Hospital.
We are